Welcome to On Call Medical Radio, a production of the Healing Words Foundation. Here with today's guest is On Call Medical Editor, Dr. Rick Holm.
We're here talking with orthopedist Dr. Pete Looby from Orthopedic Institute in Sioux Falls. Thanks for joining us, Pete. Let's talk about the ACL, or the anterior cruciate ligament injuries that we're seeing so much. We're seeing it in young people in particular. What is it?
Thanks, Rick. Great to be here. ACL, anterior cruciate ligament, one of the four major supporting structures of the joint, the most commonly damaged ligament in the knee that requires surgical treatment. MCL is a little more common than ACLs. We usually treat those non-surgically.
Okay. And then how do you make the diagnosis? I mean, why does it happen?
Okay, so like with all things, it's history, physical examination, diagnostic imaging. We start with a history. It's typically an athletic individual who was performing some sort of activity where they had a twisting injury to the knee. They felt a pop, had immediate pain and swelling, were unable to continue doing the activity. They then come to the physician's office. They've got this, on a physical examination, a swollen knee, painful, and when you test, there's something called the Lockman test. And when you do the Lockman test, you find that the ACL is very lax, very loose. It's torn. It's not doing its job anymore. X-rays typically are normal. MRI scan will show the tear in the ACL beautifully usually.
Okay, and what are treatment options?
Non-surgical treatment for patients whose knee is low demand. So 55-year-old who just happened to step in a badger hole while they were hunting, but their typical activity level is no greater than getting in and out of their bass boat on a regular basis.
Okay.
That person could probably be treated non-surgically. Exercise, time to heal, possibly a brace. The more typical ACL patient, the high school, college athlete, the 30-year-old basketball player, they're going to need probably ACL reconstructive surgery to get a good, stable knee that they can cut, twist, and pivot on.
All right. We'll be back in just a minute.
Watch On Call. Physicians from around the state using science-based, reliable medical information to answer your questions live. Thursday nights at 7 Central, 6 Mountain on South Dakota Public Broadcasting.
We're back talking with orthopedist Dr. Pete Looby of OI in Sioux Falls. So, is there a way I can prevent this?
If you avoid all twisting, turning, and contact activities, that would probably do it.
That would do it.
But that's probably not a good option for most of our ACL patients. In the subset of female basketball players, high school and college age, it has been fairly well shown that a specific exercise and training routine can decrease the risk of them tearing their ACL. Most male athletes tear their ACL in a contact, fast, high energy, and there's nothing they could probably do to prevent that from tearing.
And one quick answer on how to surgically treat it.
Okay, so basically we don't do a repair of the ligament. We don't go in and repair or stitch together the torn pieces. We remove the old ligament, put a new ligament in place. Repairs of ACLs historically have not done well at all, but the reconstructive procedures have allowed people to get back to playing pro basketball, pro football, and live a normal life again.
Hey, thank you very much for joining us, Pete.
My pleasure, Rick. Thanks for having me.
And thank you, and until next time, stay healthy out there, people.
You've been listening to On Call Medical Radio. On Call is produced by the Healing Words Foundation and made possible in part by the South Dakota Foundation for Medical Care. The foundation strongly urges all of us to remember immunizations this season. Pneumonia and flu shots save lives.